Welcome to Module 4, Apple Health Eligibility Factors. This presentation will cover the following topics: Washington State residency, date of birth, Social Security numbers, citizenship and immigration status, and resources. Washington State residency. Washington State residency. Per WAC, or Washington Administrative Code 182-503-0520, a resident is someone who currently lives in Washington and intends to continue living in Washington permanently or for an open-ended period of time, entered the state looking for a job, or entered the state with a job commitment. An individual does not need to live in the state for a specific period of time before being considered a resident. Apple Health programs are limited to Washington residents. For information on residency criteria for individuals that are residing in an institution, see WAC 182-503-0525. Children age 18 or younger. In addition to the previous slide, a child age 18 or younger is a resident when the child lives within the state, even without a fixed address, with a parent or caretaker who is also considered a resident, the child's parent or caretaker is a resident, or the child is age 13 or older and can attest to their own residency. Temporary absences. An individual can be temporarily out of state for more than 1 month and still be considered a resident if they intend to return to the state once the purpose for the absence has been accomplished and are not determined eligible for Medicaid in another state. For more information, see WAC 182-503-0520. Washington State visitors. Individuals visiting Washington are not considered residents of Washington. Examples of those who are not residents include individuals from out of state who are attending college in Washington and intend to return to their home state after completing school, or individuals who entered Washington without a job commitment, are not looking for work, and do not intend to stay. Washington State visitors. Another example of an individual who is not a Washington resident is a temporary visa holder. Generally, a temporary visa holder is not a Washington State resident unless they intend to reside in Washington after their visa expires, entered the state with a job commitment, or entered the state looking for a job. Please note that meeting the residency requirements does not make temporary visa holders automatically eligible for Apple Health. Individuals must meet all necessary eligibility components to be eligible for coverage. Washington State residency. An individual who enters Washington State only for healthcare is not a resident and is not eligible for any medical program, except for individuals who move directly into a Washington nursing facility. The residency rules for institutionalized individuals are described in WAC 182-503-0525. Now we will apply this information to several scenarios. State residency scenarios. Scenario 1. Lisa enters the U.S. from overseas with a tourist visa. Lisa gives birth to Henry, and both return home after a 2-week stay. Are Lisa and Henry Washington residents? No, neither Lisa or Henry are considered residents because they are only visiting. Scenario 2. Mary is receiving Apple Health coverage and must take care of her ill grandmother who lives in another state. Mary expects to be gone for several months. Is Mary still a resident of Washington? Yes, Mary is still a resident of Washington because her absence is temporary and she will return to Washington. Scenario 3. The Smith family came to Washington State from Montana for cancer treatment at a local children's hospital and plans to return as soon as their child completes treatment. The family will be here for a minimum of 6 months and could possibly be longer depending on the progress of the treatment. Are the Smiths Washington residents? No. Since the family entered the state for medical care and they plan to return home, they are not considered residents. Scenario 4. Justin and Brittany are in the U.S. on student visas, attending college, and have Allie, their U.S.-born child, age 2. The parents apply for Apple Health. When asked, Justin and Brittany declare they intend to return to their home country with Allie when they finish with school. Are they Washington residents? No. Since Justin and Brittany do not intend to live in Washington indefinitely, the family is not considered residents. Date of birth. Date of birth. Correctly entering an individual's date of birth is critical to ensure the individual is approved on the appropriate program. Take some time to review the table below to familiarize yourself with the MAGI programs and their age requirements. Date of birth. Here are the age requirements for non-MAGI programs. Take some time to review and familiarize yourself with these age requirements. Note that SSI-related program and the Medicare Savings Program both have a minimum age requirement of 18. For SSI-related medical, the individual must be either 65 or older, or 18 or older and have a blindness or a disability as defined by the Social Security Administration and determined by DSHS. The same age requirements apply to the Medicare Savings Program as well, but the individual must have been receiving Social Security or railroad disability benefits for at least 24 months. Social Security number. Social Security number. A valid Social Security number, SSN, or proof that an individual has submitted an application for a Social Security number is required for all Apple Health programs, except for Apple Health for Refugees, Apple Health Alien Emergency Medical, Apple Health for Newborns if the birth parent was receiving Apple Health on the date of delivery, including through a retroactive eligibility determination, and Apple Health for pregnant individuals and children who do not meet the citizenship criteria described in WAC 182-503-0535. Please note that household members who are not applying do not have to provide their Social Security number. Social Security number. When an individual is unable to provide their Social Security number, either because it is not known or has not been issued, they must provide proof from the Social Security Administration that an application for the Social Security number has been submitted, and the Social Security number when it is received. Apple Health is not denied or terminated while waiting for the Social Security Administration to send a Social Security number. Social Security number. Individuals who are required to provide a Social Security number or proof of a Social Security number application, but refuse to do so, will not receive Apple Health coverage unless they are not able to obtain or provide a Social Security number because they are a victim of domestic violence, are not eligible to receive a Social Security number, or may only be issued a Social Security number for a valid non-work reason, or they refuse to apply for or provide a Social Security number for well-established religious objections. Citizenship and Immigration. Citizenship and Immigration. All Apple Health applicants must provide their citizenship or immigration status, which determines what program they are eligible for. Individuals fall into one of the following groups: U.S. citizens, U.S. nationals, qualifying American Indians born abroad, lawfully present qualified non-citizens, lawfully present non-qualified non-citizens, immigrants who are not lawfully present. For more information, see WAC 182-503-0535. Citizenship Categories. Let's review the different citizenship and immigration groups. Who are U.S. citizens? U.S. citizens are individuals born in the U.S. or its territories, Guam, Puerto Rico, the U.S. Virgin Islands, and residents of the Northern Mariana Islands who choose to become U.S. citizens, individuals who have become naturalized U.S. citizens, and certain individuals born abroad to at least one U.S. citizen. Citizenship Categories. Who are U.S. nationals? U.S. nationals are individuals born in American Samoa or Swains Islands and residents of the Northern Mariana Islands who do not choose to become U.S. citizens. Who are qualifying American Indians born abroad? Qualifying American Indians born abroad are individuals born in Canada and have at least 50% American Indian blood, regardless of tribal membership, or individuals born outside of the U.S. and is a member of a federally recognized tribe or an Alaskan Native enrolled by the Secretary of the Interior under the Alaska Native Claims Settlement Act. Non-citizen categories. Who are qualified non-citizens? They are individuals who are lawfully present in the U.S. and must meet or is exempt from the 5-year bar. The 5-year bar is a restriction that prohibits qualified non-citizens from receiving federal benefits during their first 5 years of their qualified immigrant status, unless they meet one of the exemption rules or have continuously lived in the U.S. since prior to August 22, 1996. Who are non-qualified non-citizens? They are individuals who are lawfully present in the U.S. whose status is not included in the qualified non-citizen category. And who are immigrants who are not lawfully present? They are individuals who entered the U.S. without document inspection or who entered the U.S. lawfully but whose status has expired or been revoked by United States Citizenship and Immigration Services, or USCIS. Citizenship and Immigration Chart. This table shows different citizenship and immigration statuses and their potential eligibility. Take some time to review and familiarize yourself with the different citizenship and immigration categories and the different Apple Health programs they may be eligible for. For more detailed information on this subject and to view the Citizen and Non-Citizen Guide, view the Healthcare Authority's webpage listed below the chart. In the next slides, we will review in more detail the qualified and non-qualified immigrant statuses. 5-year bar rule. As mentioned on a previous slide, some individuals must meet or be exempt from the 5-year bar rule before they are eligible for certain Apple Health programs. The 5-year bar rule applies to the following individuals: lawful permanent residents, parolees granted parole for at least 1 year, abused spouses with children with an I-130 notice of prima facie approval or a pending approved self-petition under the Violence Against Women Act, VAWA, or those admitted to the U.S. as a conditional entrant prior to April 1, 1980. Please note that the 5-year bar does not apply to individuals who have obtained a qualified alien status within the last 5 years if they entered the U.S. prior to August 22, 1996, and have continuously lived in the U.S. since prior to August 22, 1996. Pregnant individuals and children do not have to meet the 5-year bar and can receive medical coverage with no waiting period if all other eligibility requirements are met. 5-year bar exemptions. A lawfully present qualified non-citizen is exempt from the 5-year bar if they were admitted to the U.S. as a refugee, granted asylum, granted withholding of deportation or removal, a Cuban or Haitian national who was paroled into the U.S. or given other special status, and a Amerasian child of a U.S. citizen under 8 CFR Section 204.4a, and Iraq or Afghanistan nationals who have been granted special immigrant status. For more information on this, see the Healthcare Authority's webpage listed here. Armed service members, veterans, or family members who are LPR, or lawful permanent resident, parolee, or abused person. 5-year bar exemptions. Also exempt from the 5-year bar are individuals certified or approved as a victim of trafficking by the Federal Office of Refugee Resettlement, or if they are family. Hmong or Highland Laotian tribe members born before May 8, 1975, whose tribe assisted the U.S. military during the Vietnam era, and their spouse and unmarried dependent children age 18 or younger. Citizens of the Republic of the Marshall Islands, the Republic of Palau, and the Federated States of Micronesia have special right under compacts of free association and are lawfully allowed to enter, reside, and work in the U.S. but are not U.S. nationals. Lawfully present non-citizens. Now let's review non-qualified immigrants. Lawfully present non-qualified non-citizens include but are not limited to business visitors, students, and tourists entering the U.S. for a limited time for a specific purpose, a fiancé of a citizen, applicants for adjustment of status, asylum, cancellation of removal, suspension of deportation, or withholding of deportation or removal, K, S, U, or V status visa holders who are allowed to work and eventually adjust their status to LPR, cancellation of removal, suspension of deportation granted, or deferred action except for deferred action for childhood arrivals or DACA, immigrants paroled into the U.S. for less than 1 year, not lawfully present immigrants. Individuals who enter the U.S. and are not lawfully present or entered legally but their lawful present status has expired could qualify for some Apple Health Medicaid programs. For more information on citizenship and immigration status, including definitions, please visit the Healthcare Authority's webpage listed on this slide. Resources. For additional materials and resources regarding the information discussed in this presentation, visit the Healthcare Authority's web pages listed. For community partners, the Healthcare Authority has made available a team of eligibility policy representatives to provide assistance for questions regarding eligibility and assistance with Washington Healthplanfinder applications. These representatives serve specific counties. For more information about the Washington Volunteer Assister Program, contact us at HCA Volunteer Assister at hca.wa.gov.